Neck, here's of course the trachea, right? The top of the trachea we have the larynx, the purbox, we have the esophagus, the soft tissue that's near the trachea, that's the food chute. We have a couple of carotid arteries here and here. If you come down, of course, on top you got the superior vena cava, branches into the brachiocephalic right and left, and mine is a little torn up, but the jugular would be anything going up towards the head, and the subclavian would be anything going towards the arm, as far as veins go.
So that's the blue is the jugular?
The blue are veins, yeah. So blue would be a jugular. The arteries are not quite as large, and they're a little bit pink. They're not real red. But the arch of the aorta is actually attached to the surface of the heart, so you're not really going to see that. But there are two branches that come off it on the cat. The first branch is the brachiocephalic, and it gives three branches, one going into each carotid, and then one that heads out to the subclavian, out in this direction. The other subclavian is coming directly off of the aortic arch. Okay, so that's the left subclavian. Of course, this is the heart. Of course, these are the lungs, each of the lobes. This is your diaphragm muscle. So that's the thoracic cavity as far as we're concerned. Okay? So below we have the liver, a lot of liver there. Between a couple of lobes of the liver, there's this little soft structure that gives. It's not real hardy, not sturdy, and that's the gallbladder. Usually has a little pigment going in there as well. If we move that up, again, the stomach is pretty obvious. Just make sure you understand that the beginning of the stomach is where the esophagus is coming in. That would be the cardio region. And the end of the stomach that leads into the small intestine, that's the pyloric region. There's a membrane coming off the stomach. That's the greater omentum. Right. If you lift up on the greater omentum, you will expose the pancreas, which this is the duodenum again, the small intestine, and it wraps around the head of the pancreas right there. My pancreas is well demonstrated with the ink, with the dye. So the pancreas runs out like this. Not every pancreas is going to be this colorful. Okay? So again, this is the beginning of the small intestine, so that's the duodenum. The middle, of course, is jejunum. And then if I just identify the large intestine, you can tell the big difference here. So large intestine, and you just walk it back a little bit, it gets a little tangled. But if you walk it back, you'll see where the large intestine meets the small intestine right here. Large intestine, small intestine. So this is the ileum, and this is the cecum. The first part of the large intestine is the cecum. Okay? And of course the membrane that holds the small intestine in place, we call that your mesentery. Okay? The only two membranes, you have mesentery and greater omentum. Okay? And that's the digestive tract really. Here we have one kidney, and here's a ureter coming out of the kidney, traveling down to the bladder, which is this structure right here. And so it's coming in on this side. There's another one on this side as well. If you pull this back, you have a good view of the urethra, which leads out. Okay, so on one side you have the ureter, here. On the other side, the urethra, and this is the urinary bladder. And as far as sitting on top of the kidney, there's the kidney. Mine's sort of, this blue that you see is just a blood vessel that ruptured and allowed the dye to get in. But here's the adrenal gland. Okay, it's just a bean-like structure. It's usually close to the kidney. And then lastly, this is a female. So you have two ovaries out at the top, and the structures that are on top of are the uterine horns. Sort of the fallopian tubes in humans, but they're actually weird because these animals have litters rather than individual, and the litters, the fetuses, grow inside these fallopian, these uterine horns. Rather than the body of the uterus is just where these two horns come together. It's really not anything but a passageway. So, good to go? That's everything on your list. And again, down here, I'm not going to get too crazy with it, but you have the inferior vena cava, and next to it, the aorta. Okay, and I'm not going to get into the branches coming off of that. Although it gets pretty interesting down there. You can see the branches pretty clearly. But we already did blood vessels, so we're good there. Okay? Good job.